Good morning and welcome. I call this third meeting of the House Budget Review Subcommittee on Post-Secondary Education to order. At this time, we'll have Ben call the roll.
Representative Baker, Representative Brown, Representative Truitt, Representative Bowling, Representative Bray, Representative Petrie, Representative McCool, Representative Tipton, Chair Riley.
Here. Looks like a lot of people took a snow day today. We will look at doing the minutes later when we have a quorum. Our first group today that will testify is Northern Kentucky University. So Dr. Thompson, if you could come up to the table and introduce yourself and any of your colleagues for the record. Thank you.
Good morning, Chair Riley. I'm Katie Short-Thompson, president of Northern Kentucky University, and these are my colleagues Eric Gentry and Jenny Sand. We're delighted to be here with you this morning.
Thank you, and go ahead.
Absolutely. So I'm pleased to be here to give you some updates about the university as well as our budget priorities for the coming biennium. I arrived in matters to address with our budget deficit. I'm pleased to report that we have a balanced budget for the past 2 fiscal years. We've taken it from a $24 million to a balanced budget in this fiscal year. To manage our enrollments, grow our pleased with the fact that our first year student enrollments have grown 17% last year, and we continue to support their success and see incredible student success metrics. So for example, our students' graduation rates have increased, our time to degree has shrunk to 4.2 years, and we're really pleased with the success of the students whom we serve. About 37% of our students are first generation college students, 39% are Pell eligible. As we think about what makes NKU special, it is the return on investment that we offer to the Commonwealth. We have been, for the third year in a row, recognized as being the best value by the Wall Street Journal, third straight year. And what that focuses on is the fact that we have very affordable tuition, that then our students are able to pay off their student debt within a very short period of time. For our students, it's 14 months period of time where they pay off their tuition costs. It also recognizes the fact that our students are able to land lucrative positions upon graduation. NKU ranks 62nd in the nation out of 600 schools, and we're really proud of the fact that we are the only public university that has made the top 100 ranking. It speaks volumes about the value, the return on investment that NKU is. We've also been recognized by our accrediting body, SACS. They have given us the Torch Award this year, and it focuses on affordability, on quality, accountability, and measurable improvement. Again, we are the only public university in Kentucky to be recognized. And lastly, we're really pleased with the progress that we're making in terms of reducing our students' debt upon graduation. That debt level is down 36%, or almost $9,000 over the past 5 years. In other words, NKU is leading the Commonwealth in debt reduction, and it's really important. It's exactly what Americans want in a degree, high quality that's affordable. We have also been very focused, not just access and success, but we're also focused on workforce alignment and the pipeline to lucrative careers. I work really hard with my colleagues to make sure that we are creating high-producing degree programs that are tied to regional workforce needs. So whether it's our MBA program, nursing, social work, or information technology, we've been working really hard to make sure that all of our academic programs are well aligned with those sectors that need our graduates most. We've been creating new programs that align with the needs of our region's economy. We've created programs in artificial intelligence. We've created a military and a veteran leadership minor. We have a number of new programs in our business college, namely sales analytics and supply chain analytics. We've worked really hard in our College of Informatics to create the cybersecurity program, and that has aligned well with demand. Additionally, in our College of Health and Human Services, we created a program called cardiovascular perfusion, and it has been really popular as well. And lastly, there's a growing ecosystem in Northern Kentucky in the life sciences, and we are working hard to produce needed programs to align with those needs. And lastly, one of my priorities since being president has been to create something that makes the university easier to access for employers. We created what's called the Norse Network Hub, and it's really meant to meet the talent needs of our region. Universities can be large places, hard to navigate for outsiders, and we've worked hard to create a system where we have a central hub that employers can come to find talent, whether it's experiential learning, internships, for example, or whether it's hires upon graduation. We want to make it easy for employers to find the talent that they need and then to work with that hub that then has spokes in the colleges and can connect those employers with the right talent at the right time. It's really meant to be an easier, seamless transition from their time at the university into the community to work in our midst. In case you don't know, 82% of our graduates stay in Northern Kentucky to work and live upon graduation. So we're excited about what the hub will simplify for employers and students alike. I want to speak next about our top priority as we approach this biennial budget with you. The single most important thing for us to request is an alignment in our general funding, in our base funding. When you look specifically at where NKU is, we are the least funded. We have the lowest general fund, the lowest base of all the universities in Kentucky. When you look at the fact that we are the youngest university, that is the rationale for us being the lowest or the least funded. We'll show you a number of charts today that make it clear where we are in comparison to our peers. When you think about the fact that we have moved into a performance funding model since 2016, at that point, it was one of the universities asked to have an adjustment to our base. And at that point in 2016, a request of about $10 million was made, and we were able to receive about half of that. We're now here to ask for the other half of that. That model went live, as you know, in 2018-19, and while we have performed well in the performance funding model, we're still behind because of the lack of funding equity. And so I will say that we have performed well. We've been consistently third in performance funding, but as you know, the funding model is weighted toward the Research One institutions and volume change rather than simply high performance. So when you look at the differences across the institutions per FTE or full-time equivalent, you can see that we are at the bottom at $5,176 per full-time equivalent. And then, of course, the column in the middle is how many FTE students the universities have and what the general fund is. We'll show you this in various ways just to make the point. If you look at us, we are at the far right in this illustration, again, at the very bottom of the funding, the lowest base funding in the state. And one more example is if you look at our base funding in comparison to our tuition funding, we are far more tuition funded than any other institution. We are 65% funded by our students' tuition dollars, 35% by our base, by the state. If you look at the other institutions, they may be closer to 50-50, or in some cases even more state funded than institutions' student tuition funded. And so it's really important for us now to make this request of you respectfully to adjust and align our budget to be in line with the median level of the regional comprehensive universities in the Commonwealth. If you look at the difference between the median of the non-Research One institutions and our number, the gap is $488 per FTE. If you multiply that times the number of students that we have in terms of FTE, that number is nearly $5 million. So at this point, before we reopen performance funding's model, we respectfully ask for that alignment, that adjustment in our recurring base of $5 million annually. And then there are a number of other ways in which the legislature can provide support, not just to NKU, but to all of us in the state in terms of important investments in higher education. One example is tuition waivers that are important to all of us and provide access to education for many different populations. We simply ask that a FAFSA requirement be applied to all of those students as well, so that we can then apply last dollar waivers, saving many of us as much as half in that funding of those waivers. Secondly, as many of you are aware, the Department of Revenue stopped gathering our debt last April, and it makes a huge difference in our ability to collect, having the ability to have tax liens placed on those debtors. It makes a difference of only 12% is gathered from private collection agencies versus 54% by the Department of Revenue. I know that work is underway there, and we appreciate your support in that endeavor. What we've learned recently also from House Bill 500 is that fire and tornado insurance premiums were not included in that budget draft, and we asked for that to be included. Ideally, in fact, it would be good to have that funding for all of the university's premiums put into our base, so that knowing that it's a constant cost year after year, and all other state agencies have this covered. So we'd appreciate that funding as well. I know that the CPE has asked for inflation adjustments, and I simply would say that like every single business, every year there are inflationary adjustments that need to be made for wages and for operations. All sorts of inflation issues occur in all of our budgets, and we simply echo the importance of the CPE's requests that have been made. And finally, the performance funding model support that's been requested by the CPE is something that is also important in all of our priorities. I do want to now stress that asset preservation funding is exceptionally important to NKU. We've had about $46 million in asset preservation funding in the last biennium, and in this current House Bill 500 draft, it's about $17 million. I want to just stress how important these asset preservation dollars are to maintain or to operate our buildings effectively. These dollars pay for things like HVAC replacement, roof repair. This is not about building lazy rivers or about building climbing walls or anything extravagant. It's about continuing to keep safe, functioning buildings, and we have a lot of them. So we ask for your help in maintaining the same or an increased amount for AP funding, because it's essential for us to address our deferred maintenance costs. And then in terms of a capital appropriation request, we have invested, thanks to you, in improving the state and quality of our buildings. Our current priority is our business building. The Hale College of Business has a business academic center building that is in need of repair and renovation. We've asked for $150 million to do just that. In case you don't know, we have a number of flooring issues in Highland Heights in our buildings. There's something called heaving shale. It simply means that the foundation is structurally having challenges, and they're expensive to repair. So that's one of the parts of this project, along with HVAC and a complete renovation of the business building. It would also allow for us to expand the footprint of this building to create a larger space for our Center for Innovation and Entrepreneurship, something that is certainly an important part of the Northern Kentucky ecosystem. And finally, we're interested in adding in some life sciences core research facilities for the growing life sciences ecosystem. And then next, we were asked to provide 3 different capital priorities. The first is the business building. The second is Nunn Hall. And the third is what we call the MEP, or Math, Education, and Psychology building. Those 2 additional buildings are really the last of the most needed renovations on our campus. Nunn would be a $100 million renovation, and it would just essentially provide much needed dollars to relocate departments and completely renovate the spaces, modernize the spaces, and make sure that they are ready for those different program needs, and make sure that they're equipped for the education that happens in that hall. Thirdly is the MEP building, $99 million in state funding over the biennium for life cycle renewal, space modernization, and to make sure that it is well equipped to provide education for those students who are in mathematics and in education and psychology, particularly noting that our education program is growing in order to meet the needs of the teacher shortage pipeline. And then, one other item that I would like to include today is that we have had the great privilege of having an additional request at this late date. We have a program called the Young Scholars Academy, and we have come to you in recent years to talk about the success of the Young Scholars Academy. What we have asked for in the past was funding support that's in line with Gatton and Craft Academies at 2 other institutions. When I have asked for those requests in the past, I was encouraged to find a private investor, much like Gatton and Craft's Academy. And the good news is today I'm here to report that we have $5.4 million that have been given with the contingency that the state matches those fundings on a recurring basis, as Craft and Gatton Academies have. The Young Scholars Academy, in case you don't know, is an incredible dual credit opportunity for our students. Our students come from junior and senior high school years, their full junior and senior years, and they come in this robust dual credit program where they are at the same time simultaneously earning 60 credit hours of college credit. What's unique about this program is it's really focused on our first generation and low income students in Northern Kentucky. And it is also workforce aligned. So the tracks of the program are quite literally aligned with education, healthcare, IT, business, and so those students earn in 2 years their high school diploma as well as their, an associate degree, 2 years of college credit. This program is a difference maker for our students. Those YSA, as we call them, those YSA graduates are actually outperforming native students in college. They have the highest success rates. They have 98% college going rates. 80% of those students stay in the Commonwealth to earn their baccalaureate degree, and 54% of them stay at Northern Kentucky University to earn their bachelor's. In other words, this is the single best dual credit program I have seen in my entire career, and frankly, it is worth investing in. The students in this program, currently we have 300 students in the program. We're looking to grow with this investment, grow the program to 600 students, allowing for the YSA to be the single largest program by 4 times in the Commonwealth. So we would respectfully request for your support in matching those dollars to enable our Young Scholars Academy program to grow and to succeed for many years to come. I want to thank you for your support and offer myself for any questions you might have.
Any questions? Representative Tipton?
Thank you, Mr. Chairman. President Short-Thompson, good to see you again
Always good to
today. I don't know if you've ever met former Representative Diane St. Onge,
I have not.
but she was a staunch advocate for NKU and the equitable funding. She was a force to be reckoned with, and she really worked on getting that first $5 million. But I understand why you're requesting that, and I understand how the inequity came about. Couple of points. Of course, Representative Baker's House Bill 379 has language to address the issue with the Revenue Cabinet and collections.
Thank you.
I have House Bill 479 on the tuition waivers. I'm getting a little pushback, so I'm going to ask you a question. I'm 66 years old, and I don't personally believe that if I wanted to go back to college, the university and the taxpayer should pay my tuition. So I struck that 65 and over language. Do you have many people who are 65 and over who currently use that waiver program? And if we were to strike that in law, is there anything that would prevent you from continuing that if you wanted to?
It's a great question, Representative Tipton. So I actually did look at the number of students who pursue education through various tuition waivers, and I don't have them all memorized, but I do know that number. I know that last year we spent $66,000 on the Donovan Scholars, as we call them, and so it's a fairly small number of students who are pursuing that education, 6 to 10 students, depending on how many hours they're taking. I will say that some will say that it is a beneficial financial benefit, of course. And I agree with you that if it's something that we could raise funds for externally, it could be something that we could continue to support if it's no longer provided.
Well, just to follow up on that, are these students actually pursuing degrees and stuff, or if they just want to take classes, could they still audit the classes?
They can always audit the classes. So I do know that some of them do pursue their degrees and some do not. Of course.
Okay. Okay, so Dr. Thompson, let me go over this again. You're requesting a $5 million in the base funding,
Yes, sir.
and of course, a lot of the things that a lot of the universities are talking about, the tuition waivers, the inflation adjustments, performance funding model support, all of those, asset preservation. Of course, that's the same thing everybody's hitting on pretty much.
Correct.
So your your capital projects are the Business Academic Center. And did you put those in priority in 1, 2, 3 in
Yes.
this? Okay. And then Nunn Hall and MEP renovation. Okay. All right, sounds good. Thank you for your presentation.
And our last priority was
And your last one, yes.
was the what we're calling the Vitruba Young Scholars Academy, which would be named after the 4th president of Northern Kentucky University, and it's to match the $5.4 million investment.
And that's the figure you're asking for is
Yes,
5.4
please.
million. Okay. All right. Thank you. No other questions from anybody? Dr. Thompson, thank you so much for your presentation. Appreciate it.
Thank you, Chair
Have
Riley.
safe travels back to Northern Kentucky.
Thanks so much.
And at this time, we'll have the University of Kentucky and Dr. Capilouto and any guests that he has with him. Dr. Capilouto, go ahead and proceed, sir.
Good morning, Mr. Chairman and members of the committee. I want to thank you for the opportunity for addressing you today on behalf of the University of Kentucky Board of Trustees, who is asking us to be more and do more for Kentucky. I'm also representing over 38,000 students and more than 33,000 employees who are also committed to doing more and being more for Kentucky. I'm honored to speak on their behalf because I think in the spirit of gratitude they would like for me to tell you we are honored to be your partners in advancing Kentucky in everything we do. There are many ways I could talk about our sacred mission through education, research, service, and care. I could awash you in data, but what lifts me every day are the stories I hear. They are countless. And I'll share just one person's story today because I think it expresses our mission more than I ever could. After a miscarriage, Gabby Morrison felt deep loss. She had a panic attack. She was in her home at West Liberty. She went to UK St. Clair Hospital in Moorhead, where she received a chest exam and 2 biopsies and learned the unthinkable. She had lung cancer. She didn't smoke. She took care of herself and her 2 young children. She was then referred to our Markey Cancer Center in Lexington, where she was diagnosed with a very rare form of lung cancer. After surgery and chemotherapy, doctors enrolled her in a cutting-edge clinical trial typically available in centers like ours that involved advanced immunotherapy. So today she is in remission. She's found a new purpose in life. She works with a nonprofit group and raises awareness about the causes of cancer. And she also is a volunteer on a canine search and rescue mission in eastern Kentucky. Gabby said, "When I got this diagnosis, I realized I just wanted to start doing things that matter. Doing things that matter. It's important in life. It's even more important for a university. A community hospital with deep regional roots detects a disease. A referral is made to one of the nation's preeminent cancer centers. A young mother with a new lease on life devotes herself to paying it forward. One life saved, a mother gets to watch her children grow, and a family remains intact. That's our mission. It's the power and impact of an institution like ours that in partnership with you does everything in its power to advance the health of its citizens. So many of you have heard me talk about the numbers that depict the progress you've made possible. Over the last 15 years, enrollment has increased by more than 10,000 students, and graduation rates are among the highest in the country. Nearly 10,000 degrees and credentials were conferred in 2025, up from fewer than 6,000 15 years ago. And just yesterday, I received updated numbers regarding research and development at UK and the direct significant economic impact felt throughout Kentucky. In fiscal year 2025, we earned $500 million through competitive grants. We go up against the best in the country to support our research and development, focusing on what most challenges Kentucky. It supports over 5,000 jobs, and it generates more than $1 billion of economic impact. Across our hospitals, we treated and discharged 72,500 patients last year, more than double of what we did a decade ago. The Markey Cancer Center that treated Gabby is the only National Cancer Institute designated comprehensive center in the state, one of just 57 in the country, ensuring that Kentuckians don't have to leave home for the very best of care, no matter how rare the disease. And many of you know the work we have provided through our extension agents in 120 counties. When those storms ravaged western and eastern Kentucky, our agents were there. They delivered food and supplies, sometimes on horseback, and were there to help communities rebuild. Our board gathers every year at a retreat. It's a time to refresh, examine what we're doing, and give us a charge in going forward. They were pleased with our progress, but they weren't satisfied, and truthfully, they never are. They push us, and that's a good thing. At that retreat, they charged us to distinguish ourselves not for the fame, but for what it would mean to our state, and that was to be recognized as a university far greater than any in the country that did more to advance the state we serve. And out of that, we birthed the Advancing Kentucky Together Network. We established partnerships with community hospitals like ARH and Pikeville, educational institutions like Transylvania, nonprofits like the Kentucky Primary Care Association, and now, most recently, major corporations like Microsoft. We share the same powerful idea that only working together as trusted partners can we significantly improve the health, expand the opportunities of education, and make life better. And as artificial intelligence rapidly expands, our board at its last retreat challenged us to again become the partner of choice when it comes to this matter. And that charge was informed by the interactions they had with your colleagues, a panel who met on our campus and interacted with our board in 2024. So I thank you. Everyone on our campus is engaged as we grapple with what I believe is the most powerful technological and economic force in our time. Kentucky is attracting opportunity because of the momentum you've helped create through tax policy, careful stewardship, and long-term vision. But serious challenges remain. Despite progress, Kentucky leads in the wrong direction in too many indices of health. We're improving, but not quickly enough. And while more students are graduating, we must meet even more of them where they are with what they need and with what Kentucky needs. So whether it's a technical certificate or associate degree in a field where jobs are well paying but unfilled, or whether it's a graduate or advanced degree critical to creating jobs, or upskilling opportunities for someone in the middle of life or career. And we have to look what is facing Kentucky. Declining birth rates after the Great Recession herald a demographic cliff that's starting to hit now. Frankly, there'll be fewer college-age students to go into that workforce. And yet many of the skilled jobs that we know we must be prepared for required a bachelor's and many times a master's degree. At the same time, the population is aging, meaning more retirements and fewer workers. States that overcome these trends with an ample supply of educated and healthy workers will hold an advantage. At UK, we've opened our doors widest to students from Kentucky as we've grown, while expanding opportunities for those from other states, because we know about 1 in 4 of those remain in Kentucky after graduation. So we need to work together across all of our institutions to make sure we build that robust workforce of healthy, educated individuals. We recognize your first budget is lean by design. We respect this. You're being careful fiscal stewards, and asking for accountability results in relevance. I was on a panel recently that examined the future of higher education. There were 3 questions. They're very similar to the ones I hear from you and as I walk the halls here. Number 1, are we accountable? Number 2, what will the support you provide yield for our states, and in our case for Kentucky? And are our universities providing something relevant and lasting today, tomorrow, and long into the future that we will continue to see rapidly change? So we're tackling all of these issues in many different ways. I want to share a few examples. Are we being accountable? Now, it's often assumed in an organization as large as ours that every unit needs one of everything. And you know that that's not sustainable. You need one IT department, not dozens. One unit to promote and tell the institution's story, which is largely Kentucky's story. And under one roof, you can bring areas together like dining, facilities, and groundskeeping. Simply put, we are consolidating services, improving efficiency, and increasing transparency in areas such as contracts, travel and partnerships, expenses, which we now publish regularly. We're doing these things so that our people can spend more time employing their skills and expertise in the work that is central to what they must do, and not some of the day-to-day drudgery and tasks that technology can assume. This is the way we can improve efficiencies. And we're doing this not because we need fewer workers, we need more workers, because we're going to continue to grow and serve Kentucky. Our employees are going to be asked to do more, and we've got to provide space and skills for them to excel. You have generously provided us the resources to advance Kentucky. We will continue to work and prove ourselves worthy of this. Next, what will the support you provide yield for Kentucky? I could mention several things, and I'll mention a few in a moment, but I'm going to focus on AI because it provides both promise and peril. So we must future-proof our students, preparing them not for their first job, but for those successive jobs. Weeks ago, the Stanley and Karen Pigman College of Engineering launched the state's first Bachelor of Science in AI. The inaugural class will start this coming fall. AI and machine learning specialists are projected to be in the top 3 of job demands in the future. So we've got to move quickly to fulfill this demand. But our employees, our current ones, need to be equipped to use these tools effectively. And we must understand how to leverage AI to extend healing to more places and enhance the patient experience. So I'm going to give you an example. Imagine when you go to your physician, sometimes now you can see a provider that has to sit behind that computer to take notes or document every symptom, your medical history. That's important, but they have to do it for insurance reimbursement as well. It'd be great if they could spend more time facing you, discussing your concerns eye to eye. This vision is fast becoming a reality at UK Healthcare, where we're using AI documentation tool from Microsoft. So as your physician spends time talking to you, all of this information is automatically captured, downloaded for the physician to review in a timely and efficient way. We're among the first universities in the country to partner with Microsoft at this level, and that partnership is adding momentum. Just a few things on the horizon. We're laying the groundwork for a physical presence of Microsoft on our campus. Faculty have been and will continue to partner with Microsoft to deliver tailored training for students and employees, and to extend this opportunity to all our participants in the Advancing Kentucky Together network. Our IT teams are collaborating to provide engineering expertise to support the customization of AI tools across research, care, teaching, and service. And later this month, we'll host a campus-wide Microsoft event with engagement zones ranging from responsible AI and ethics to showcasing technologies, many of those already being developed by our own students. So the last question, are our universities providing something relevant and lasting? Certainly, a Healthy Kentucky research building that made possible our successful recognition as a National Cancer Institute designated center. You made a decision about that investment 10 years ago, and it yields today, and I believe it'll be lasting. But collectively for a community and personally for an individual and a family, few things are more meaningful than a purposeful job. So we know that as we examine how to fund us in the future, it isn't just enrolling and graduating students. It's ensuring that they are prepared to compete in an aggressive market, to secure jobs that pay well, that are sustainable, and that we keep more of them here in Kentucky and attract more businesses. Our campus is organized around that ambition. We're building Kentucky's future workforce, we tell ourselves. Our board directs us to focus more intently on this. And we've started gathering clearer data on workforce outcomes, examining our majors, our credentials, our programs, and how they align with what Kentucky needs in the future. We're going to need more complete data to make progress that is meaningful and to honor the investments you're making in us. But I want to share some of the limited national and federal data that are currently available. So we know where about 2/3 of our graduating class in 2024 are 6 months after graduation. 82% of them are employed, continuing their education, engaging in service or military, for instance. The median salary was more than $55,000. Interestingly, UK graduates living in other states, for which we have data, earn $11,000 more than those who stayed in Kentucky. We're not exactly sure why. What is the gap? It is the particular degree, job, cost of living, but we need to understand these questions and more so that we can make wise investments, and we look forward to being your partner in this. I want to talk about the promise that we try to honor, a promise and a dream that Kentucky tomorrow will be healthier, wealthier, and wiser than it is today. Our 4-year medical campus in Bowling Green was launched in 2018, followed by a full medical campus in Northern Kentucky in 2019. I will note all of that was without additional state dollars. In 2015, the University of Kentucky graduated 500 medical students. In 2025, the number was 800. Within the next decade, the number will be 1,000, nearly double from where we started in 2015. So how do we do this? We opened those satellite campuses in northern Kentucky. We continued our 20-year program in Moorhead. And building on that momentum, we are increasing enrollments in all of those programs and on our campus as well. We've grown, we've been responsive, and we did this without requesting more state dollars. And also because of your support for the Michael D. Rankin Health Education Building that opens in 2027, we will open our doors to thousands of more future health professionals. It's the fastest growing job market in this country. It'll make us one of the largest medical schools and health sciences schools in the country. You have information about our two most significant capital requests: the second Healthy Kentucky Research Building and continued support for asset preservation. That first Healthy Kentucky Research Building you funded is full. Since 2018, when it opened, more than $600 million in research awards have flowed through that building to support labs, shared equipment spaces, and focusing on the health challenges that plague Kentucky. That return of $600 million, which supports wages and training, equipment, supplies, $600 million generated in 7 years is nearly twice the investment you made in 2013. There is bipartisan support in Congress for basic science research. In the budget just passed and signed by the President, Senator McConnell was instrumental in securing $65 million for this next facility. It's a testament to his belief in what talent and infrastructure can do. Next, asset preservation. Thanks to you, we will be opening the Whitehall, or reopening the renovated Whitehall classroom building. It's 150,000 square feet, 46 modern classrooms, modern collaboration, and technology-enabled space. And across campus, we're renewing facilities to support teaching, research, and service in many ways. And we will appreciate your help because we can do so much more. In terms of our operating assets, as we transition from capital to these priorities, we request continued inflationary support, just as all of our sister universities have requested. That state support, the first dollar in, we consider it the most important. It's the engine that fuels what is now a nearly $9 billion enterprise that creates jobs, powers the state's largest healthcare system, and supports one of Kentucky's largest employers. We couldn't do it without the first dollar. And when you implemented performance funding, we responded. We aligned resources with workforce need and state priorities. And since it was mentioned that this is weighted towards research universities, I will make this simple clarification. Every metric in the performance funding model is restricted to undergraduate education. It is weighted to account for what research universities do and others don't. And that is 10,000, in our case, graduate and professional degrees, which are the most expensive education you can provide. So the weights have a rationale. I look forward to working as a participant in the performance funding work group. Everybody on our campus understands how important it is that all of our students are successful, and that performance funding model is understood deeply, from our boardroom to the boiler rooms on our campus. So we believe we have answered the call to advance Kentucky in everything we do, and we want to keep doing so as your partner. And we think we can do so most effectively by remaining accountable and transparent, by ensuring our work advances your priorities, by accepting your challenges, and wisely spending the investments you generously grant to us. We're grateful for the capacity and flexibility you give us to fulfill our promise to advance Kentucky. Mr. Chairman and members of the committee, thank you. I'm most willing to answer any questions you may have.
Thank you, Dr. Capilouto. And I have questions from both Representative Tipton and Representative Baker. Representative Baker, why don't you go ahead first?
Thank you, Mr. Chair, and thank you, Dr. Capilouto, for the presentation. You mentioned accountability a number of times in there, and I appreciate that. And I think we all recognize that we're all accountable to someone, and ultimately we're accountable to the taxpayers. Yesterday, there was a media report that said the Department of Sociology that DEI is still there at the University of Kentucky. Could you tell us what this looks like and what the commitment of the university is related to DEI?
Sure. We have worked tirelessly to be in full compliance with House Bill 4. Anytime we have learned in any kind of way of a report of something that is inconsistent with that, we address it. I learned of that last night. I can assure you we will look into it, as we've done when we've had reports in the past. But we worked extensively after that bill was passed to be in full compliance.
Can I have a follow-up, please?
Go ahead.
I appreciate the response. If a university is found to be in violation of that law, should that university continue to receive taxpayer funds?
Well, yeah, you make those decisions. I would ask you to look at the totality of what we do. If we have a particular incident that is wrong or out of compliance, we're going to address it. I would hope that we would be able to do all the things that I've mentioned today, which is to increase the number of graduates that reside and work in Kentucky, that we're able to do the research that overcomes the health challenges that face Kentucky, that we're able to sustain a health system that can be responsive to people like Gabby. I would hope we would be able to continue those.
I appreciate the response, but in hoping to continue to do those things, I would hope that we would make sure that we're compliant with the law that doesn't divide students, doesn't divide families, and doesn't divide communities. And I appreciate your continued efforts to look into that to make sure that you are following that law. Thank you.
Yes, sir.
Representative Tipton?
Thank you, Mr. Chair. I may have a couple of questions. Mr. President, always good to see you. I know that when the tornadoes went through western Kentucky, the Princeton Research Farm was pretty much decimated. Could you share about where the status of the rebuild? I think there was a grand reopening recently. Could you just kind of update us on that project?
Yes, sir. I think it's a day that was very tragic, because just a few years before we had cut a ribbon on a sort of new facility there, and when I visited, everything had been almost wiped clean. It was devastating. I was struck by volunteers who came in busloads, who walked through those fields by hand to pick up some debris that would have been dangerous for cattle, for instance. And I don't think I've ever received more emails about the essentiality of rebuilding. I met with soybean farmers who told me if it weren't for the research that had gone on at that facility, going back 100 years, that their families would have been out of business. So we understand the essentiality of that, and it is being completely rebuilt in a very modern way. We appreciate your support. A good insurance program is important, but we're building anew, and we're going to be as strong as ever, and we celebrated our 100th anniversary. And to see what you mean to a community and a state on a day like that is very uplifting, sir.
If I may proceed, Mr. Chair.
Yes, sir.
Now, when I was on campus in the late 70s and early 80s, I took a lot of classes in Ag North and Ag South, and those buildings will soon be no more. They're going across the road to make room for an expansion of the hospital. Could you just share with us a little bit about what this new project is going to include? Is it going to be more patient care, more patient rooms, research, and what this expansion of the medical facility is going to mean for the state?
Yes, sir. We still have more demand for beds than we have beds. We're doing a good job of reducing that. We also have in our original Chandler Hospital a few hundred beds that are over 60 years old, and their size and their infrastructure don't support the modern care you need to provide. We also have a few hundred beds in Good Sam Hospital that have outlived their usefulness. That's on the northern part of our campus. So we need to replace those beds and then build additional beds. I can get you the exact number. I'm a little hesitant to give you the breakdown right now. But that's why we need to build a new tower. And I hope soon you can visit those new ag buildings, because that's going to provide state-of-the-art space for research and teaching, critical part of our economy.
Go ahead.
Now, Mr. President, we had talked several times after the Coldstream Farm transaction about the possibility, and of course I'm a former dairy farmer, so that's kind of important to me, and there was hope that maybe we would have another dairy research center at one time, but that has not come to fruition. Is that something that's still a possibility, or is that pretty much off the table at this time?
Chair Tipton, I'll have to look more carefully into that. We've engaged in lots of partnerships with commodity groups and all, and I'm not exactly sure where that is. I'm sorry, sir.
Thank you, Representative Tipton. Dr. Capilouto, thank you so much for your presentation. Jennifer gave me some folders earlier.
Yes, sir.
It will give me some reading, and also it will be part of my weightlifting program. So we appreciate that so much. Dr. Thompson, we appreciate you coming today also. Thank you, and at this time we'll be adjourned.